Hey, welcome to BACKtalk, the premier podcast from Successful Black Parenting Magazine, featuring in-depth conversations and expert insights on crucial topics for Black families. We're ranked one of the top 4 Black family podcasts on FeedSpot. I'm your host, Janice Robinson-Celeste. I also need to tell you about our Black Parenting Academy. We are now launching that on April 14th, not April 7th. We pushed it back so we can continue to be great. We have some amazing master classes for Black parents. So go to blackparentingacademy.com right now. Get on the waiting list. That's blackparentingacademy.com. Now back to our show. Before we even begin, I want our listeners to sit with this because today starts Black Maternal Awareness Week. Are you aware that Black women in America are 3 to 4 times more likely to die from pregnancy-related causes than white women? And that's according to the CDC. Why is it that in one of the most supposedly medically advanced countries in the world, your zip code and your skin color can determine whether you survive childbirth or not? Let that sink in. How did we get here? Well, stay tuned and let's find out.
This is BACKtalk by Successful Black Parenting Magazine, the most listened to podcast for parents by parents.
Let me stop moving. Hello, everyone. Thank you for tuning into BACKtalk by Successful Black Parenting Magazine, your go-to podcast talk show for parents. Now, I need a little favor from all of you listeners out there. Go ahead and spread the word about our show. The more you engage, the more we all can thrive. Tell your friends, shout it out to your followers, because sharing is truly caring. And don't forget to use hashtag BACKtalk when you post. Now, on this episode of BACKtalk, our special guest is Dr. Faith Ahuba. Now, I want to just welcome her to the show. Hey, Dr. Faith, how are you?
Hi, how are you?
We're good. Can you start by introducing yourself, sharing a little bit about your background in women's health and why Black maternal health is so personal to you?
Thank you so much for having me on the show. My name is Dr. Asoha Faith Ahuba, a board-certified OB-GYN here in Houston, Texas. I am a specialty medical director as well as a clinical associate professor at University of Houston. And for me, doing OB-GYN is not only a calling, but also involves deep advocacy work, education, empowerment, and helping women, not just individually, but on a community level. So the title and the focus of Black maternal health, and mortality is beyond overdue. So I am just excited that it's being talked about more, and there's, things labeled as awareness weeks and months and things of that nature, because it's quite embarrassing, I think, for the country.
Yes.
Yeah.
I agree. I agree 100% with that one. Yes.
Yeah. March of Dimes has a report out that gave the U.S. I think a D+ in maternal health and more in infant health. Yeah.
So that's where we are. We're a D student. We're a D student with a plus. I don't think it matters, the plus at this point. Wow. Well, before we dive into this very important topic, you've accomplished so much. I saw your bio and I'm so proud. But what's one surprising or little known fact about you that people might not know?
One surprising fact about me that people may not know.
It's our icebreaker, yes.
That's the icebreaker. I'm actually quite laid back. I think when I speak in certain situations, I have a very demanding and commanding tone. We're also surgeons, right? Yeah. And so I think what people really get to know me, they realize I'm quite laid back and silly.
Okay, and I hear the baby. We are a parenting. That's okay. We are a parenting podcast. Baby noises are welcome. Matter of fact, I may start incorporating baby noises where I can hit a button. Just like applause. No, we have babies. Hey! I love that. No, it's fine. It's perfectly fine. Well, let's get real because, why are Black women still dying? I mean, this has been going on for a few years now, 3 to 4 times the rate of white women during childbirth. We're in 2025. Who is failing us?
It's a complicated situation. I'm going to be very honest with you. It's multiple levels, from provider education to nursing care, to community support, to patient advocacy, to, sometimes the patient population just getting sicker, right, as well. But when it comes specifically to Black women, you can't ignore systemic racism. That is fundamental. I don't know if this is going to make sense, but I started framing the problem when I talk about it to people and to patients. What's a trendy term that's going on right now? Narcissism, right?
Yes.
And when we talk about narcissism, a crux of that is a lack of empathy. How do you teach empathy in healthcare? I think if we can address that, we can start to crack the code to addressing Black maternal health and mortality.
I see. Because you have people out there. We always have our conspiracy theorists, right, for everything. They're like, oh, it's just another way they're trying to kill us and get rid of us, But it's more complex than one little explanation that's not even research-based, right? So we have doctors who aren't listening to Black women, as we know from some cases that have happened. What else is it?
So you have doctors that are not listening. You have situations where patients may not even recognize their own level of being sick, right? Recognizing early maternal warning signs, for example. So hypertension and preeclampsia is huge amongst women of color. But if you don't understand what the disease is and even how to recognize it, you're going to be, putting your chances at risk. I myself had postpartum preeclampsia, actually, and felt nothing. But I knew and understood what to look for. So even the CDC has an initiative or a program called Hear Her, right? That advocates and teaches about early maternal warning signs. So that's one thing, education about your symptoms and awareness. Another thing is using your voice to advocate, right? So one of the things that...
It's okay. He's fine.
He's saying poopy butt.
It's okay. We know that's part of development. It's okay.
All right. I apologize.
So we have bathroom talk on BACKtalk. It's fine.
Okay. All right. One of the other things actually is patients need to learn how to advocate for themselves. And not just that, doctors need to learn how to listen to what patients are talking about, right? And then one of the other things I can definitely say that happens in my institution is implicit bias training, right? Yes. And that's something that can start not only, of course, out of practice in clinical practice, but also in medical education and training, right? The concept of not just implicit bias, but also bedside manners, right? You can't always, again, that goes that empathy part about practicing medicine. So those are some of the things that could address at least the racial aspects of it.
Right. And I can tell you from firsthand experience, the implicit bias, unconscious biases have been going on for decades and decades. Mm-hmm. And I shared this before on BACKtalk that I experienced it with my first daughter. Because I had to go to a clinic, so I didn't have an attending physician. So I didn't know who I was going to get to deliver my baby. It was a toss-up. And I met him for the first time while I was in labor. And I was still shy then, but also in labor. And he came up to me. And I did everything I could. From the time I found out I was pregnant at 3 months, and I was a young girl, like I was 18. And skinny, tiny little thing. Tall but skinny. And he came up to me and said, while I'm in labor, this baby is going to be small. It's going to be too small. And I'm looking at him like, he's looking at me, he said, you did, what did you do? You didn't do something. This baby's small, just blaming me. Right. And I remember being there like shocked, like, you're saying this to me now? I know. And I'm going through my head, like, I did everything right. I don't even drink milk, but I made sure my doctor said milkshake every day. So I did that because I could tolerate that. I mean, I was going through my head of what could possibly have gone, what did I do wrong? My baby popped out 7 pounds, 11 ounces. 7 pounds, 11 ounces. I only gained 15 pounds. So, and she was 7'11". And he came to apologize. I'm still in pain now because she also broke my coccyx bone. I didn't know right away because I had an epidural. So I didn't know. I knew I was shaking from the pain, but I didn't know that the coccyx bone had broken because I had such a small frame. And I couldn't really talk to people after. I remember that. And he came to me to apologize. And still, again, all I could do was stare at him. I guess he thought I was a deaf mute because all I could do was stare and like in disbelief, like, and I remember being angry, but couldn't say a thing. So I know, and this is white doctor, of course, white male. And of course, I took it. Uh-oh, we just lost you for a minute. If you can hear me, just refresh and I'll bring you back in. Sometimes this happens. But we can refresh. You can refresh the page. Let's see what happens. We lost her there. You can edit it in. I'm going to bring myself up when she comes back. But yes, at the end of that delivery, I had a perfectly healthy baby, and this doctor was nowhere to be found. Nowhere to be found. And here I am getting yelled at as if I did something wrong because I'm a young Black mom about to deliver a baby. That will be the transition. Can I pause it? So yeah, I experienced that way back when. I'm not going to tell you how long ago. Way back when.
Mm-hmm.
And so it's still going on today. And I think we should be ashamed of ourselves for it. But what do you think?
I do. I think everything happens in baby steps, and part of public health changes is understanding that there's many levels to it. And sometimes the first step is bringing it to public awareness. So some of these alarming statistics I've known for a while. I'm not actually shocked. What I'm shocked is how long it took to get public attention. I'm gonna be very honest with you. So I think that is the beauty of the situation is when you have the public engaged, right? The people who are actually affected can continue to advocate for themselves and have conversations like this, which draws attention of policymakers, right? Hospitals, further research being needed. It causes a whole shift in trajectory. Even now, some of the things that I've just kind of in my own personal time looked into is the advancement of healthcare using digital medicine, AI, telemedicine, virtual stuff. All of those cutting edge things are part of the solutions for the Black maternal health and inequity dilemma that we have.
Yeah, I agree. Now, if the healthcare system were a person, what would you say to them on behalf of Black mothers who did not survive their pregnancy or childbirth? Just speak your mind.
I would say, what if I was your sister?
I like that. Exactly.
What if I was your sister? And that's why I brought that whole that humanistic piece of it there, because I personally treat everybody with love as a person, as a human, and that draws obviously women who look like me and also women who don't, right? But that's what I would say. What if I was your sister?
That is deep, and that's how every doctor should look at every woman, is that there's somebody related to them. You don't treat them any differently. And I think we can get that to happen. That'd be awesome. But we know that the different personalities of doctors probably won't allow that to happen, even with training. But hopefully we can get this needle to move, and we will have safer births for our community. Now, you've worked inside the system. What are the everyday like microaggressions or biases that you see doctors and nurses display that could possibly put Black mothers in danger.
I could write a book on this.
I'll give us a few examples.
How much time do you really have? I see a lot of assumptions, right? So one of the things that, if people don't already know, is Serena Williams' experience, right? Which is, she has access to top line care. She had multiple comorbidities going on at time of birth and postpartum. And what the issue was, people weren't listening to her. So some of the things that I would see is women who are actually doing what we say, you know, advocating and speaking up based on their intuition that something doesn't feel right, and still being ignored. So I've mentioned this before, where in other settings, we escalate when it comes to customer service in terms of, my meal wasn't created well, I didn't get this at the store. I'm not necessarily saying carry that mindset into medicine, but escalate, right? I need women to feel comfortable and not feel scared escalating. So what I've seen is, when I've encountered situations where I talk to my patients, like, I didn't know, how come I didn't want to say anything, Dr. Ahuba? I was scared that they would hurt my baby if I said something. Right. So that was a new layer for me to understand, that although we're over here saying advocate and become aware, the lived patient experience may also be surrounded by fear of retaliation again on their baby because they said something. And that never crossed my mind. So when I started seeing that and experience that, it made me, really understand, a different perspective of what these women are going through as well. And so when I say escalate, it's strategic, right? Okay. It's strategic. So there's the one way that you could advocate is just to complain randomly about the nurse, but you can specifically ask for a patient access representative. You can specifically ask to speak to the labor and delivery manager, the women's director, whatever those administrative titles are at the hospital. You can ask to speak to those women, those individuals in particular, and file formal complaints. So if you have these different things, they're able to document. And what happens is, hospital makers, policy makers will see trends and start to make changes. Whether that involves, taking a look at the culture in the labor and delivery unit. It's deep, but my point is, don't underestimate the power of your voice as a patient. Never underestimate. Just be strategic with it.
Are they teaching advocacy now in birthing classes? Because there should always be someone with you if you can help it, but are they teaching this, how to advocate for yourself as well as a partner, how to advocate? So if your wife or partner says something's wrong, you know what to do?
I don't believe that they are. I believe a lot of it has to do with, techniques of calming down and birthing and kind of understanding your body in that particular situation. To my knowledge, I don't think that's a huge or a major part of but that's a great idea. And that's why people now lean into doulas. I love doulas. Right. I love doulas.
I like it too.
Come to my office, come to the labor and delivery room. So that is something that I think all women should definitely consider looking into, because even when you're in labor or you have a complication, you may not even have the strength to advocate for yourself.
Yes.
So making sure that you have a team, whether it's your partner, a sister, or somebody else there.
Yeah. And you don't know all the time. And I remember still, again, my first daughter, if it's probably back 100 years ago, I probably would have made it. I was in labor, but I remember my water didn't break. But I was laying on a gurney. I don't know why I wasn't in a room yet, probably because I had the clinic type of healthcare. But I was laying on a gurney, and my husband came in, and because I was married, I got married when I knew I was pregnant, so I got married. And he came in and he told me that it looked like a murder happened because it was so much blood all over the floor. Like, he said, all around the gurney. I had no idea that I was bleeding like that. And I couldn't even see it because I was too weak to even peek over. So I had no clue. And he's the one that alerted the nurses that something's not right. Is she supposed to be? And I wouldn't know anyway. It was my first baby. That's the other thing, right? So he alerted the nurses that I was, bleeding everywhere. So and I've heard stories of people like hundreds of years ago when it happened, they just did not make it. They just did not make it. So that's one thing. Now, is this about race or is it about racism? Because that's the difference. Like, is it about our skin color or they just don't like us? What's going on? Like, what role does this implicit bias play in how our doctors treat our Black mothers? Like, should they even be doctors doing this if they have the racism side versus just, looking at us and assuming things?
So I think it's a complicated question because one thing that we can't ignore is that poor outcomes even happens if your physician is of color.
Right.
Right. That can happen. Right. So the other thing that happens is in medical training, we're kind of taught. I'm not saying we're taught to stereotype, but we're taught in boxes. I don't know how to explain that. For example, we'll be taught that the description of a patient comes in and they'll have their I'm sorry.
It's okay. How old is he?
He did not do that.
How old is he though?
4.
3. I thought he was around 3 or 4 because it sounds about right.
Yeah,
okay.
He's 4.
Okay.
He's 4.
Okay.
Yeah.
He's your co-star today.
Apparently so. He doesn't go to the hospital with me.
He does?
No, he does not.
Oh, does not. That's like, how do you do that? Okay.
Yeah. No, so the when it comes to implicit bias, I think that the training is important because you don't know what you're thinking, right? You have to kind of have that brought to your attention. And not just implicit bias, but I also think what's also missing is simple communication. Communication, right? Because what we've said all along is patients speak up, provider listen. And that can happen regardless of race. So some of it also becomes like, are you stopping and taking the time to listen and to connect? I know John Maxwell has a book called Everybody, I think Talks, but not everybody connects. I don't know if you've heard of that before. Yeah. Everybody communicates, but not everybody connects. Okay. Is the name of it.
That's a good point.
But implicit bias is only, to me personally, is literally just a fraction of the bigger issue. To be honest with you, we can't ignore systemic racism and biases and things like that. But I also believe that when it comes to some of these issues, you also have to think about, are you as a woman the healthiest version of yourself?
Mm-hmm. I agree.
Right? Women are getting, pregnant later. People are developing hypertension. You look at your family history, right? We have to think about obesity and things of that nature. So some of these things are, what are my lifestyle? What are my risk factors? Am I optimizing my health? Now, in your example, when you talked about postpartum bleeding and hemorrhage, that is one of the things that I think can happen to anybody. Plus, it can turn horrible very quickly. And this is where, again, the provider needs to actually listen to what a patient is saying about how they're feeling, or what the family may be seeing, like you said, the bloody massacre or the scene and things of that nature. So I'll definitely say, I can talk about, like, with my system, implicit bias is something that is offered on a regular basis. So the problem that I have is you want to make sure that you're not necessarily only relying on just the training, right? Because people can check the box, right? People can actually check the box. And so that's why I took the time to, shed the example about strategically using your voice to make effective change. Right. Does that make sense?
It does. But we know that even a lot of times when we do use our voice, we're ignored. And we have the one dad that now is trying to get legislation to get doctors and hospitals to actually listen to moms, because his wife was highly educated. They had, I believe, 2 sons, and she was on the 3rd child when I can't remember exactly what happened with her, but he went to let them know, and they told him that they didn't have time for her right now. And he went back again And they's like, yeah, wait. And they kept pushing him off, and she died. She died instead of taking it seriously. So we know that even a lot of times when we do speak up, they don't listen. And what do we do in that situation? Do we get a supervisor? Do we act like a Karen and be like, we need a supervisor? I don't care what you say. Like, what do we do? Bang on the front desk?
That's what I'm saying. Yes.
Okay.
Yes.
Okay.
Because if you think about it, if it was a meal that was not cooked to perfection, where's the supervisor? Coming, so that's the strategic where I'm talking about. Like, I'm not saying like fight the people, all that kind of stuff, but I kind of am, which is sorry, I'm just being honest. Because I just doing what I do, I'm just being very honest. It's like sometimes the people that complain or who are the loudest get seen or heard first, or get some of the attention. So but I would, when I say strategic, raising your voice, do that in partnership with your doctor.
Yeah.
Do that in partnership with your doctor. Like, hey, and you can also specifically ask, can I talk to my doctor? Let's say you're in labor and delivery. Is my doctor aware that I'm here? Is my doctor, so that you can escalate on your side, but also in partnership with your physician, so he or she can also escalate alongside with you. Does that make sense?
Yes. And I remember hearing Serena Williams literally raised her voice and banged on the front desk to get their attention, because she had told them repeatedly that she had this problem with blood clots. And she knew that that's what she was feeling. And they just ignored her completely until she went banging on the front nurse's station, while she's in labor, and demanding that they give her the medicine that she normally uses when she's in a situation like this. So sometimes maybe you might have to literally get loud. What are you going to do? You're in labor, kick you out? I don't think so. I mean, they can't kick you out, right? Okay. So there you go. So, do what you have to do, but make sure whoever is with you, if someone's with you, also knows what to do. And perhaps they should start teaching this in birthing classes as well, the advocacy piece, because I think it'll start there. Then maybe we'll have some luck with people saving their partners. But what do you say to people who still deny that systemic racism exists in healthcare? Because there are people that deny that racism exists, period. So what would you say to them about healthcare?
I would say it's unfortunate. It does exist. I would ask them, why do they believe that it doesn't exist? And I would be curious about their own personal lived experience. To be honest with you, we live in a country that's very diverse. You can't ignore that it happens. You can't ignore that it exists. I would definitely recount stories of women who have lost their lives or gone through, similar things like Serena Williams to them, and ask them to explain. If racism was not a factor, then tell me what was. That's what I would say.
Right. It does seem like they always come up with some other excuse, but we know there's no other reason for it on multiple occasions and different with all these statistics. What else could it be? What else could it be? Now, if you had the power, what policies would you implement today to immediately begin saving the lives of Black moms?
Oh, I love that question. Thank you. I can do anything I want. I would make sure every woman who desires a doula has one. That's the first thing I would do. The second thing that I feel is also missing in the conversation about Black maternal health and mortality is the man's voice. I would empower the men in this movement as well. The fathers, I would empower them to also have a way for them to be seen and to advocate and things like that. So doulas for all women that desire it, find a way to strategically empower the fathers as well to address this particular situation. And then two other things that I would want to do is to also increase the ability of hospitals to embrace midwifery.
Yes.
Right? I trained with midwives and I loved it, but not all hospitals actually have midwives deliver. Like right now I don't have midwives that deliver, but I have nurse practitioners in my office. So just kind of opening the mind to the use of another intermediary between the physician and the patient. that support system, right? The doulas and the midwives, that's a huge support system. And then I also would want to increase. I mean, right now we have things like Medicaid cuts with postpartum care. Knowing what I know now, I think every woman needs a year off after a baby.
Oh, absolutely.
Not
I,
weeks.
I'm a big advocate for that because I personally experiencing it. My second daughter, 6 weeks, I had to go back to work. I was nursing. And I said to myself, I remember back then, and I still was a young woman, thinking, this is so cruel. This is super cruel. We don't even allow puppies or kittens to separate from their mothers until they're 9 weeks old. Here I'm going and leaving my baby with a stranger at a daycare center at 6 weeks old because I had to go back to work. That's all the maternity leave I got. So we need a year. We definitely need a year. And I hope that one day we can see that happen everywhere across the states, and so not every, company can dictate it, but the federally it's dictated. Probably won't happen soon, but, hopefully. But, I was thinking the other day, I was like, hospitals, they love to brand themselves as diverse and inclusive, but where's the accountability? Like, should maternal mortality stats, the statistics, be public knowledge for every hospital? It should be published somewhere where, moms and dads and significant others, this is want to be all inclusive, can come and look at it and say, wow, you have a high maternal mortality rate. You have a high infant mortality rate, especially in the Black community. I don't think I want to come here. What do you think about that?
That's deep.
That is deep.
I think, honestly, I think that sounds like a great idea. Will it happen? I don't know. Right? That's a lot of accountability and a lot of transparency.
And that should be that way. We should have transparency. We should have accountability. What are they afraid of? Lawsuits, I'm sure. Not having patients, I'm sure.
Not having patients, those type of things, which is why, I mentioned strategic raising your voices so that, you can definitely have trends. And then, so there are things that are transparent, but the thing about it is this data that you're asking for, are all hospitals intentionally wanting to collect it by race and publish it by race, right? I like that.
I think it should be external company that does it, not the hospital themselves. But that leads to the next question. Should doctors and hospitals be held legally accountable for maternal deaths linked to racial bias? I know it might be hard to prove, but I mean, why hasn't that happened yet when we can prove it?
I think that's actually really hard. I'm gonna be very honest with you. As a physician, as a woman of color, as somebody that sits on various boards, you have situations where when there is a death or something morbid, emotions run high, and perception is different. Does that make sense?
Absolutely.
So I think if it's going to be based specifically on race, that's going to be extremely hard to prove. But if you have a trend, right? If you have a trend of complaints and things like that, then it makes it more likely or probable. Does that make sense? To make a case for it. So I don't know if you remember the case I don't know if I can speak on this. The case in Atlanta.
Is it the one where the baby
decapitated head?
Yeah, I hate to say it. I have a hard time getting it out. Yeah. That was.
So if you look at that particular situation, they were both the same women, both women of color.
Yeah.
Right, with a horrible outcome. Like something like that, for example, and knowing what I know in the emergency, my heart goes out to the woman and my heart goes out to the physician. So I think that question will provide a lot of justice, and being consoled, but I don't know if it would really I think what would happen, it would make people hide more than anything.
I see. Okay, hide it more. Okay, that
Hide,
makes
yeah,
sense.
you know what I'm saying? They would be like,
Yeah,
I think things would turn more sneaky, right?
yeah,
I think
you're probably
probably
right.
hide a little bit more, and I think it may be a situation where practicing may be more fear based.
I'll see. Okay, yeah, you're right. You're probably right about that. Now you wrote Peace RX, right? Or is it Peace Prescription? Okay,
Peace
Peace
RX. Oh
RX.
yeah, Peace RX, Peace Prescription. Yeah.
Okay, to address holistic healing through faith and mindset. You could tell us a little bit about that book because I think that's interesting. But how do we balance faith with the cold hard reality of a system that's failing us?
So, I'm a woman of faith, and so I do. But obviously, my name is Faith. I do believe that childbirth is for some cultures and for some people can be a very spiritual experience, right? And some people even getting pregnant can be a miracle, right? So I believe in the power of your mindset and your word. So a lot of times when I do have to give women bad news, I also tell them this is the doctor's report, but I do believe that in the power of your words and positivity and, leaning into your faith to help change the trajectory. So I have a lot of patients who look completely like train wrecks on paper, but are completely healthy and delivered well. I think there's even an article published about a patient I took care of with COVID.
Okay, wow.
Yeah, with COVID.
Scary.
She and her baby are doing just
Good.
fine. And
That's
so those
good.
are some of the things that that I employed. But Peace RX is basically a book that where I kind of flipped it. I do a lot of OB, but I also do a lot of gynecology. And so one of my passions is talking about fibroids. And so I encourage women with the story in the Bible about the woman with the issue of blood that used her faith to implore her healing. And so the whole thing is, yes, we always talk about mind, body, and soul, but we don't always talk about mindset and spirit in terms of leveraging how to heal. And only you have control over that.
And I love that. That is great. Guys, make sure you get it. Is it available? Where is it available?
It's available on Amazon.
Amazon.com. Okay. Is it also Barnes and Noble? Because we might be boycotting Amazon soon. So
No.
where else can we get it? Just in case you might want to have a secondary location.
Yes, I do. You can also join my email list and I can
Okay.
definitely send you a copy.
We'll go over that at the end of the show. So stay tuned, guys. If you're listening, stay to the end. We'll let you know how to get her book and follow what she does because she's pretty awesome with what she does. So let's talk about trauma a little bit, can we? Especially generational trauma. Does that show up somehow in Black women's bodies during pregnancy? And what do you think?
I think that is a great question. I believe it does show up in terms of when we talk about postpartum depression and your mental health, right?
Okay.
Where the concerns about the supports that you have, not healing the mother wound, because guess what are the things that we talk about when you have a baby? I want my mom around, or even in the delivery, right? So if you have a generational trauma of unforgiveness and bitterness in families, that can manifest, right? Even in the delivery, I look and I'm like, are you here? I've had women deliver by themselves.
Oh my gosh.
No mom, nobody.
I mean, I know it happens, but still, it's always nice to have someone to hold their hand,
Right. So one of the other things that generational trauma can translate into your body as anxiety, which can translate into hypertension, which can make the physician think, are you preeclamptic, right? So it goes on and on and on and on. So those are some of the more obvious ways it can translate.
Right. Now, is it that we should look for a Black OB-GYN whenever we can to help beat the odds? I mean, or we need a complete overhaul of how hospitals care for Black women, or is it both?
I believe that you should interview your provider.
Interesting. Okay.
I do. I have patients who come and see me like, I just want to just meet you before I trust you, right? I do believe there is a lot of truth to, having a provider that looks like you, that can understand your experience. So I do recommend that you interview providers, ask them questions, and then kind of take a look at the connection that you feel. Like, trust your gut. Like, do you feel like, okay, I connect with you, I can trust you, I feel like I can communicate with you? So that would be one of the things to look into, and also make sure that your provider tell they're also a person of excellence and empathy.
Okay. That sounds good. We're almost done, just so you know. I know you got to get back to the baby. Now, for those listening who are not pregnant, because we don't want to wait till we're pregnant to be advocates, right? What can they do right now to help prevent maternal deaths in our community? Wait, you're muted. There you go.
I love that question. Optimize your lifestyle. So you can actually make an appointment with your OB or even your maternal fetal medicine or even a fertility doctor. And you can label it, preconception. I would like to come to talk about my health as I attempt to conceive in advance. So one of the things that you can do is to maintain a healthy BMI or weight. Avoid the one thing that I never understood is the alcohol usage. Some women who drink during pregnancy. I know. So limit alcohol, smoking, and then genetics is a huge thing. We talked about how earlier women are getting older when they get pregnant. So you also want to take a look into your genetic history, your partner's history, are some of the things that you can do in advance.
Okay. And if you had one message for Black moms to be out there who are scared because they know this information, I know I would be one of those moms right now, knowing what I know today. What would you say to them?
I would say faith over fear.
Yes.
Yeah, honestly, I need to do this. I've been working on a journal just specifically for this because I have quite a bit of patients in my office who crying that Dr. Ahuba, I think I'm going to die.
Oh my
Dr. Ahuba, I don't want to have a second baby because I'm afraid because of my prior experience was near death. And I'm just like, we're supposed to dominate, be fruitful and multiply, but that strong fear is mind crippling, right? So I would say simply faith over fear, because when you have a child, guess what you constantly are doing? Believing in the best for your child, regardless of what they're going through. So do the same over yourself.
Yes, absolutely. And I was a crying pregnant mom on my last child, and it was not fear of death, but fear that it just hurt because I had done the epidural, had the worst experience with that. I had natural. And of course, once the pain really started kicking in, I was yelling, "Give me something, anything." But I got to say, when I took a nap and woke up, I was ready to go home, where it was just the opposite with the epidural. And then, so the third one, I didn't know what to expect. I remember that. And I went crying and had a new doctor. And he was like, "But you already had 2 children." I was like, "That's how I know. It's going to hurt. That's how I know." And so he made sure that my birth was so easy. It was the easiest out of all 3. So, and that I didn't even have to worry about then because it wasn't in the forefront of people's minds that you have to worry about dying having a baby. And today, our moms have to worry about that, as well as other things like the reproductive rights that are pulled. If God forbid something goes wrong, and how do you handle that as a doctor if you have to wait for care? Now, where are you located?
I'm in Houston, Texas.
Houston, Texas. So you have some strict laws in Texas, right, about reproductive rights, what you can and cannot do. I mean, so I'm not even going to let you answer that, but because I don't want you to get in trouble. So these are things we have to think about now. The way things are happening. So do you want to comment anything on that? At all? You don't have to answer that, but if you want to comment, go ahead.
No, I think you hit the nail on the head. Having a child nowadays has become, something that you have to think about on multiple different levels. And so I think you hit the nail on the head. And I think that you have to be more intentional about who you choose as your provider, your care team is one of the things that I would definitely say.
Okay. And finally, how can our listeners follow your work and get involved, get your book, especially get involved in the movement to protect Black mothers? Because we have grandmoms out here that will want to advocate and help protect Black mothers. So how to get in touch with you, get your book, and then how to advocate.
Thank you. You can follow along at I am Dr. Faith.MD on Instagram. I also have a secondary Instagram with my current passion project, helping women with fibroids, and that's at Mayo Imani. And there's a link for my book there as well. Regarding what you can do right now to advocate for yourself, I would definitely say ask questions and trust your intuition, and do not feel what's what I'm looking for. Feel as though you're doing too much, because you're doing this to make sure that you are healthy and that you're alive and well to take care of a healthy child and family.
Right. You're absolutely right. Well, I want to thank you, Dr. Faith, for joining us today. It's been a total pleasure. So thank you so much. Wait, you were muted again, but I think you said something there.
Thank you.
Oh, okay, no problem. And thank you for having your son join us, because it made it a true parenting show. I appreciate that. And I want to thank everyone who is listening right now. Big shout out to all of you for tuning in and engaging with us here at BACKtalk by Successful Black Parenting Magazine, the syndicated podcast that's a must for Black parents everywhere. And be sure you follow us on social media. That's so important these days, guys. Click on everything, follows, likes. Whether you like it or not, click on it. You know, we have ads on our website. Click on it, whether you buy something or not. It helps us to survive. That way we can make sure we're here year after year for you. And don't forget to share blackparentingacademy.com with a friend. It's your go-to place to get master classes by experts in Black parenting. Go to blackparentingacademy.com. And until next time, I wish you all the best and much success. So take care. Thanks for listening, everyone.
Thanks for tuning in to BACKtalk by Successful Black Parenting Magazine. We'll see you soon.
Okay.